2 blocks from home, blood spreading across the sidewalk, and the only thing I had at home that even remotely qualified as first aid supplies was a single roll of vet wrap buried in a junk drawer. That's how I learned what a real pet first aid kit actually looks like. Not during a calm Sunday afternoon, but while my terrier mix bled through a dish towel I'd tied on with hair elastics. I'm Jasmine Caldwell, and I've spent nearly a decade as a professional pet groomer, which means I've seen just about every minor injury and close call you can imagine. What I'm sharing today isn't theory, it's what actually works when things go sideways.
You're listening to Total Pet Parent Podcast. Quick thing I should mention right up front. The research, the writing, all the information you're about to hear comes from real experts and is fully human verified. But the voice delivering it to you is AI generated. Just wanted to be transparent about that. If you're a regular listener, thanks for being here. Seriously, it's good to have you back. If you just found us, welcome to the show. We release new episodes every Monday, Wednesday, and Friday, covering all aspects of pet care. Let's get into today's topic.
So let me give you the quick verdict up front. A proper pet first aid kit needs wound care basics, tools for restraint and examination, emergency contact information, and supplies specific to your pet's species. You can build one yourself or buy something pre-made, but either way, you've got to customize it for your pet's size, any health conditions they have, and the activities you actually do together. Now, let's talk about what actually matters when you're putting one of these kits together. I've assembled dozens of them over the years, for my grooming shop, my vehicle, hiking trips, and every room where my 4 rescue dogs spend time. The difference between a kit that actually helps and one that just takes up space comes down to a few key considerations. First up, species and size compatibility matters way more than most people realize. Dog kits and cat kits overlap in some supplies, but they diverge significantly in others. Dogs need muzzles sized to their snout length and width, and I'm telling you, a greyhound muzzle won't fit a bulldog, and neither will work on a cat. Cats require towels for burrito wrapping, since they rarely tolerate basket muzzles, plus smaller gauze pads appropriate for their compact paws. Small animals like rabbits, guinea pigs, and ferrets need even tinier supplies. Standard gauze is just too bulky for a guinea pig's leg. Birds require specialized supplies altogether, including styptic powder for broken blood feathers and a dark, quiet carrier to reduce stress. If you keep multiple species, build separate kits or clearly label supplies by species. Wound care fundamentals form the core of any kit. You need sterile gauze pads, 3x3 inch for cats and small dogs, 4x4 inch for medium to large dogs. You'll also want rolled gauze for wrapping, medical tape that adheres to fur without pulling, and self-adhering vet wrap in multiple widths. I keep both 2-inch and 4-inch vet wrap rolls because my senior shepherd's legs need wider coverage than my terrier's. Antiseptic solution matters here too. Skip hydrogen peroxide, which actually damages tissue. Instead, stock saline wound wash or diluted chlorhexidine at about 0.05% concentration. Disposable gloves protect you from zoonotic infections and keep wounds clean. Non-stick pads prevent gauze from adhering to wounds, which makes dressing changes way less traumatic. Examination and restraint tools let you assess injuries safely. A digital rectal thermometer with disposable probe covers tells you if your pet is hypothermic. That's below 100 degrees Fahrenheit for dogs, below 100.5 for cats, or hyperthermic, which is above 103 for either species. A pen light helps you check pupils, examine the mouth, and inspect ears. Tweezers remove splinters, ticks, and debris. Get stainless steel with a fine point and serrated grip. Blunt-tip scissors cut through fur and bandages without risking accidental stabs. I learned this one the hard way after nearly piercing my own palm with regular scissors while cutting gauze off a wriggling dog. A muzzle sized correctly for your dog prevents fear bites when they're in pain. Even the sweetest dog may snap when hurt. For cats, a thick towel works better than a muzzle for restraint. Emergency information and medications turn a supply box into an actual first aid kit. Print your veterinarian's phone number, after-hours emergency clinic contact, and poison control hotline information on a laminated card. Include your pet's medical history, current medications, known allergies, and vaccination records in a waterproof sleeve. This saves critical time at emergency clinics. Stock medications your vet has specifically approved. That might include diphenhydramine, Benadryl, for allergic reactions. The dose is 1 milligram per pound for dogs. Never give this to cats without explicit vet instruction. Buffered aspirin for pain relief works in dogs only. Cats metabolize aspirin dangerously slowly. And keep any prescription medications your pet takes regularly. I keep a 3-day supply of my senior dog's arthritis medication in my car kit since we've been stranded by weather before. Activity-specific editions customize generic kits for your lifestyle. Hikers need tick removers, snake bite protocols, and emergency blankets. Owners who travel by car should include motion sickness medication, portable water bowls, and cooling vests for overheating. If you have a senior pet with mobility issues, like my shepherd with hip dysplasia, add a stretcher or blanket sling for transporting an injured pet who can't walk. Dogs with chronic health conditions require condition-specific items. Diabetic dogs need glucose supplements and extra insulin. Epileptic dogs need rectal diazepam, and dogs with known allergies need epinephrine autoinjectors if prescribed. The relationship between senior health management and first aid overlaps more than people expect. Chronic conditions create predictable emergencies. Container and organization determine whether you'll actually use the kit. Clear plastic toolboxes let you see contents at a glance. Soft-sided bags with multiple compartments work for vehicles and hiking. Label every section and include a contents checklist so you can restock after use. I keep identical kits in my grooming shop, my home, and my truck. That redundancy has saved me twice when I've needed supplies immediately. Check expiration dates twice yearly and replace medications, ointments, and sterile supplies before they expire. Moving on to some specific options you can consider. The RC Pet Products Pet First Aid Complete Care Kit is a pre-assembled option that covers wound care, emergency restraint, and basic examination tools for both dogs and cats up to 80 pounds. The zippered nylon case includes color-coded compartments and a laminated quick reference card covering common emergencies. Check the show notes for a link to the current price. On the plus side, it includes both dog and cat supplies in one kit. You get a muzzle plus a restraint towel. The quick reference guide covers bleeding, choking, heat stroke, and fractures with clear illustrations. Compartments separate sterile supplies from tools to prevent contamination, and it meets OSHA workplace requirements if you run a pet business. On the downside, the included muzzle runs small. It barely fit my 45-pound terrier mix and won't work on brachycephalic breeds. There's no space for pet-specific medications or medical records unless you remove other supplies. And at around 10 inches wide, it's too bulky for small day packs or compact car storage. The Adventure Medical Kit's Adventure Dog First Aid Kit targets active owners who hike, camp, or travel with dogs. This water-resistant kit emphasizes trauma care, heavy bleeding, fractures, and environmental injuries over routine grooming accidents. Check the show notes for the link. What works well here is that it includes an emergency blanket, instant cold pack, and a whistle for wilderness scenarios. The waterproof DryFlex bag floats if dropped in water and handles rough outdoor conditions. The tweezers are genuine splinter removal quality with serrated tips, not the flimsy ones in most kits. And it contains a tick removal tool and antihistamine tablets pre-measured for dog weight ranges. The drawbacks are that there are no cat supplies whatsoever. This is dogs only. The included booklet assumes basic first aid knowledge rather than walking you through procedures. And it's missing a rectal thermometer and pen light, which I consider non-negotiable examination tools. The Kurgo Pet First Aid Kit is a vehicle-focused kit designed to slide under seats or into door pockets. The slim profile and dual Velcro/carabiner attachment system keep it accessible without eating cargo space. Check the show notes for pricing. It's genuinely slim at under 2 inches thick, so it fits in spaces other kits can't.
It includes a seatbelt cutter and window breaker for vehicle accident scenarios. Reflective strips on the exterior make it visible in low light, and it contains a breed-specific dosing chart for common emergency medications. However, it has limited wound care supplies, only 6 gauze pads and 1 roll of vet wrap. The nylon zipper pulls caught on gauze packaging twice, requiring careful extraction, and there's no room for customization unless you swap out included items for pet-specific needs. The Pelican 1200 case isn't a pet-specific product, but it's my personal choice for building a custom kit. This crush-proof, waterproof hard case with foam inserts lets you configure exactly what your pets need. Check the show notes for the link. It's fully customizable, which means you control every item based on your pet's specific needs. The waterproof O-ring seal protects contents from rain, humidity, and accidental submersion. The clear lid lets you verify contents without opening, and there's a lifetime warranty against breakage. I've dropped mine off a truck bed twice with 0 damage. The cons are that you're starting from scratch, which requires research and shopping across multiple suppliers. At around 8 inches long, it's larger than necessary if you only need basics. Hard-sided cases feel like overkill for low-risk indoor use, and there's no internal organization until you add dividers or foam inserts. The North American Rescue Tactical Canine First Aid Kit is a professional-grade option originally designed for working dogs, police, military, search and rescue. It's overkill for most pet owners, but valuable if your dog participates in high-risk activities or you have emergency medical training. Check the show notes for details. It contains Israeli bandages, hemostatic gauze, and chest seals for severe trauma. The modular pouch system lets you detach sections or attach to tactical vests and backpacks. It includes nasopharyngeal airways sized for dogs, which can maintain airway patency during unconsciousness, and supplies are human EMT grade, not generic pet care quality. The downsides are significant. It's way more kit than most pet owners need or know how to use. Advanced supplies require training. It's expensive, usually around triple the cost of standard pet first aid kits. It's missing basic items like thermometers and tweezers because it assumes you're supplementing existing gear, and the MOLLE webbing attachment system is pointless unless you're already using tactical gear. The American Red Cross Pet First Aid Fundamentals Kit balances pre-assembled convenience with educational support through the organization's companion app and online training resources. Check the show notes for pricing. The companion app includes step-by-step video instructions for over 25 emergency scenarios. The app stores your pet's medical records digitally and shares them with emergency contacts. It includes a pet CPR guide with anatomically correct hand positioning for dogs and cats, and American Red Cross brand recognition means it's widely trusted and meets standardized guidelines. However, the app requires a smartphone with internet access, which fails in remote areas. Supplies lean toward minor injuries. It's not equipped for serious trauma. The included scissors are household grade, not medical grade blunt tip, and replacement supplies aren't sold as a kit-specific pack, so you're hunting down individual items. Now, let me address some questions that come up constantly when I'm talking to pet owners about this stuff. What's the difference between a pet first aid kit and a human first aid kit? Pet first aid kits address species-specific anatomy, behavior, and common injuries that human kits ignore. Dogs and cats need muzzles or restraint tools because pain makes even gentle pets bite. Human kits don't account for that defensive behavior. Wound dressings differ too. Vet wrap, which is self-adhering bandage material, sticks to itself rather than fur, while standard medical tape pulls painfully on pet coats. Cats require smaller gauze appropriate for their compact limbs, and the quick reference guides in pet kits cover issues like heat stroke in brachycephalic breeds, foreign body choking, and paw pad injuries instead of human concerns.
Medication dosing is completely different. Human aspirin can kill cats, and the diphenhydramine dose safe for a 70-pound dog would be dangerous for most humans. I keep separate kits because reaching for the wrong supplies during an emergency wastes critical seconds. How often should I check and replace items in my pet first aid kit? Check your kit every 6 months and after any use, replacing expired medications, depleted supplies, and updating medical records. I set phone reminders for January and July so I'm never caught off guard by expired antihistamines or outdated vet contact information. Sterile gauze and ointments typically expire within 2 to 3 years, while medications like diphenhydramine and aspirin show clear expiration dates on packaging. Vet wrap and bandages don't technically expire, but lose adhesiveness in humid storage, so replace them if they feel stiff or don't stick properly. Update your pet's medical records whenever vaccinations change, new conditions develop, or you switch veterinarians. After using any supplies, restock immediately rather than waiting for your scheduled check. I learned this after using the last gauze pads on Pepper's paw and forgetting to replace them for weeks. Should I take a pet first aid course before assembling a kit? Yes, and I can't emphasize this enough after a decade of watching well-meaning owners make dangerous mistakes. Supplies mean nothing if you don't know how to use them. Improperly applied tourniquets cause permanent limb damage, and incorrect CPR technique can crack a small dog's ribs. Pet-specific first aid courses, the Red Cross and many vet clinics offer them, teach you how to check vital signs, perform the Heimlich maneuver on a choking dog, flush a wound without driving debris deeper, and recognize when you're dealing with a true emergency versus something that can wait until morning. The course I took covered restraint techniques that protect both you and your pet, plus it walked through common grooming injuries I now see weekly at my shop. Even if you're confident with human first aid, pet anatomy and responses differ enough that species-specific training matters. That said, don't let lack of formal training stop you from building a kit. Having supplies available beats having nothing, and you can learn basic wound cleaning and bandaging through reliable online resources until you can take a class. Can I use human medications from my medicine cabinet in a pet emergency? Some human medications are safe for pets in specific doses, but many are toxic and dosing errors kill pets every year. Diphenhydramine, or Benadryl, works for allergic reactions in dogs at 1 milligram per pound, but you need to verify the product contains only diphenhydramine. Combination cold medications with decongestants or acetaminophen are deadly. Buffered aspirin can relieve pain in dogs, not cats, at 5 to 10 milligrams per pound every 12 hours, but regular aspirin causes stomach bleeding. Never give ibuprofen or acetaminophen to dogs or cats. Both cause organ failure. Pepto-Bismol contains salicylates that poison cats and can harm dogs in incorrect doses. My rule is don't give any human medication to your pet unless your veterinarian has explicitly approved that specific drug and dose for your specific pet's weight and health conditions. Keep a written list of vet-approved medications and doses in your first aid kit so you're not making judgment calls during an emergency. The relationship between nutrition and medication tolerance affects how pets process drugs, which is another reason to consult your vet rather than guessing. What's the bare minimum first aid kit for a healthy young pet? For a healthy adult dog or cat with no chronic conditions, your minimum kit needs sterile gauze pads, rolled gauze, vet wrap, antiseptic wound wash, disposable gloves, blunt-tip scissors, tweezers, a digital thermometer with probe covers, and a current list of emergency vet contacts. Add a properly sized muzzle for dogs or a thick towel for cats. That covers the most common emergencies I see: cut paw pads, minor lacerations, foreign objects in paws, tick removal, and overheating assessment. Store these basics in a labeled, zippered bag and keep it somewhere you'll remember during panic, not buried in a closet. As your pet ages or if they develop health conditions, expand the kit with condition-specific supplies and medications. My Senior Shepherd's kit includes joint supplement backups and anti-inflammatory medication, while my Young Terrier's kit stays minimal since she's healthy. Pet life stages change, so understanding senior-specific needs helps you anticipate when to upgrade from a basic kit to something more detailed. Here's what it comes down to. Preparing a pet first aid kit isn't about buying the fanciest pre-made package or assembling every possible supply. It's about having the right tools for your pets, stored where you can grab them instantly when something goes wrong. I keep 3 kits now, one at home, one in my truck, and one in my grooming shop, because emergencies don't wait for convenient locations. Start with wound care basics, add species-specific restraint tools, include your pet's medical information and vet-approved medications, then customize for your pet's size, health conditions, and the activities you do together.
The best kit is the one you've actually assembled and know how to use. I've watched too many owners freeze during emergencies, staring at supplies they don't understand while their pet needs immediate help. Take a pet first aid course, practice opening your kit and locating supplies, and check it twice a year so nothing expires or goes missing. That panicked morning with Pepper's bleeding paw taught me that preparation isn't paranoia, it's part of responsible pet ownership, just like the daily feeding and grooming routines we don't skip. Build your kit this week before you need it. That wraps up this episode of Total Pet Parent Podcast. Thanks for listening. We drop new episodes every Monday, Wednesday, and Friday, so there's always something new coming your way. If you got something useful out of this episode, leaving a 5-star rating and a quick review really does help. It's how other pet owners find the show when they're searching for answers. And if you haven't already, hit subscribe or follow so you get notified the second a new episode goes live. Talk to you soon.